Hello, hello. Come on in and take a seat. My name is Lee and I am the medical assistant that will be getting your vital signs and taking you back for today's visit. Do you mind confirming your first and last name for me? All right, and it looks like you are right on time for your appointment. It looks like we actually just have you for a routine physical exam. Does that sound about right? Awesome. Just wanted to make sure. So let's kind of get all your stuff in order here. Any changes to your insurance at all? Okay. And it looks like we need a pharmacy on file for you in the event that Leanna sends you any scripts. Do you have a preferred pharmacy you would like us to send any medications to? And what city is that in? Okay. Okay. All right, I got that all set up for you. Looks like your primary contact is mom. Did you want to change that as far as, I'm sorry, I said primary, my emergency contact. Would that be correct? Okay. And any changes to your primary phone number? Good to go there. Awesome. All right, so let's open up your chart then here and get you checked in. Just a few general questions since we've last seen you. Any new changes to your medical history at all? Are you taking any new medications? Okay. And any recent surgeries that we should be aware of in the past year? And when was that? Okay. Any changes to your smoking status or alcohol consumption? Okay. And any new cancer diagnosis in the family as far as your primary relatives, whether it be breast, ovarian? Okay. And at what age were they diagnosed? Okay. Awesome. Now, aside from the routine physical assessment today, did you need anything in particular? Were you having any concerns at all throughout your body? Doing pretty well? Good. Yes, so today will basically just be a general assessment of the full physical exam. So they'll take a look at your scalp, your face, take a look inside your mouth, your eyes, your nose, just kind of make sure everything looks good up here. Listen to your heart and lungs, assess extremity sensation, and like a general skin assessment, that sort of thing. For sure. Okay. So let's get all the information in here. And I am going to start a chart for you. So we'll just get your vital signs first. Do you have a preferred arm you want me to use? Okay. So let me put some hand sanitizer on here. And of course, you'll just rest your feet flat if you don't mind. Place that over here. All right, if you wouldn't mind just slipping your arm through there. There you go. Does that feel secure? Good, good. I'm just going to take a quick listen. pressure is normal. Let me loosen this around your arm a little bit. And do you think you could slide your arm out there? There you go. Awesome. Just get this hair out for you. And then I'm just going to get a temperature check underneath. It's a sublingual one, so underneath your tongue. And do you know roughly how your height and weight at this time? Okay. Let me just make note of all of that. And I forgot to ask, are you taking any supplements or vitamins right now? Okay. Gotcha. All right, now let's get that temperature. This is going to go right underneath your tongue. I'll give it some time to calibrate. Very good. Temperature is normal. Awesome, awesome. I'm just going to throw this away real quick. Alrighty, so let me get that in here. Alright, so it looks like you are all set to go for your vitals. Let me get you checked into the system so Rihanna knows that you're here. You are all roomed up in room 3. Awesome. Do you have absolutely any questions for me or any concerns you wanted me to write down that Leanna should address today? Alright, so yeah, we'll get that full physical exam going. One thing I am going to ask you to do, if it's okay with you, I'm going to write your patient identifier number on here, and I just need you to leave me a urine sample just in case we have to run it for any tests depending on what she's looking for. So I am going to keep this for you here, and then you could bring it back in and she can test it just to make sure there's no signs of blood or bacteria in your urine, okay? Absolutely. And then I am going to leave the stripe right on the table there. You can cover this up. I think it may be easier if you maybe take the top off. You can keep, like, you know, undergarments on, of course, and then we'll be able to do the full body exam for you. Absolutely. So I will leave that there for you. And then Leanna, the PA, should be in shortly. Not a problem at all. You are so very welcome. I'll give you some privacy. Let me actually take out some gloves for her too. I think that's the only thing that I didn't leave out. Perfect. All right, and then she will be in. I'll see you at checkout. Hello, hello. How are you today? Good, good. My name is Leanna and I will be doing your physical exam today. What brings you into the ASMR clinic? Just kind of routine? Okay. So Lee, the medical assistant, I took a look at your vital signs. Everything looks good there. She was just telling me, really you're just here just for that routine annual physical, but having no concerns, nothing that needed to be addressed otherwise. Okay, just wanted to make sure. So yeah, you know, with that being said, let me then put some sanitizer on. We'll put some gloves on and we'll get everything going. Yes, and then you of course let me know if you have any questions at all during the exam. All right. So, I'm just gonna kind of be doing that full examination today. I will let you know if we have to move you at all at any point during this exam, but you should be good for the most part. And of course, if you're ever uncomfortable or you feel lightheaded or anything, you just let me know. All right. So what we're gonna do is I'm actually gonna start just by looking here. Shift you just a little bit. I'm gonna just examine your scalp area, okay? So you're just gonna feel my gloves here at the top of your head. And you know what may help actually? I'm gonna reach over here and we're just gonna kind of shine a light on your head area here, just to kind of make sure I don't see any skin changes or cuts or lumps. Super healthy. I'm not feeling any masses or lumps in the head. The hair follicles do look healthy. So I take it no hair loss, right? Good. Okay, let's kind of move over to like a general facial exam here, okay? I'm just gonna press on your forehead area here. Okay, again, I'm kind of taking a look at your skin. I'm gonna press here on your sinus area. I'm gonna assess some of your lymph nodes now, okay? Just gonna move this just a little bit. Just making sure they're not enlarged or swollen. Noting the mobility and the shape and the size. Okay, very good. So I'm just going to take a pen light to take even a closer look than this light here. So I'll put that away for now. Just going to take a pen light and just examine your face here again. Okay. Alright, do you mind looking straight ahead? Yep, and just don't move your head for me. I'm just gonna move your lid here just for a second. Awesome, your lower lid. Good. Same thing with this eye. Okay, this lower one. The lashes do look healthy, so no sign of skin conditions there at all, so that's good. Do you mind looking up just to take a look in your nose, noting your turbinates? Doesn't look like I see any abnormal discharge. Okay. I am just going to take a tongue depressor here. Do you mind saying ah for me? Ah, there you go. One more time. Ah. Okay. You are going to be due for a couple throat swabs today, so I am super sorry about that. But we'll do that in a second. Now I'm going to just take a look in this ear real quick. You're going to feel me grab it. Taking a look at the outside, the inside, no sign of infection. Very good. I'm going to take a quick look at this ear. Sorry for my reach. No tenderness on the auricle here. Very good. And then no signs of internal ear infection here. You haven't been having any ear pain. Good, good, good. So what we'll need to do then is I am going to collect those throat swabs, okay? So if you wouldn't mind. And you're done with one. Good job. Just one more here, okay? Say and you're good there. I will send those out to the lab, of course, letting you know if it shows anything. Next thing is I just want to measure your breathing output. So I'm just going to ask you to just take a deep breath and blow into this device, okay? Okay, are you ready? We're just going to place that here. Take a deep breath in and deep breath out. Very good. Try again. Deep breath in and deep breath out. Much better. All right, very good. So far, you were doing great for this physical assessment. Next thing is we are just going to test your hearing here, okay? So let me take a seat and come a little bit closer. All right. If you wouldn't mind, I'm just going to have you cover the opposite ear and close your eyes, and then you let me know if you can hear a sound, okay? And if you can't, then let me know when it stops. You hear that? Okay, let me know when it stops. Very good. You hear that? Let me know when it stops. Very good. Awesome. So we're going to switch to the opposite side now. If you could close your eyes again. You hear that? Good. You hear that? Good. Very good. Awesome. And then next we're just going to test sensation of the face. If you could close your eyes for me, just let me know when you feel something soft. Okay. Good. Excellent. Good. Good. Very good. And was all the sensations equal on both sides? Just making sure. Excellent. All right. Next, if you wouldn't mind, is I'm going to take a listen to your heart and lungs. So we'll just take a quick listen at your heart here. Just normal breaths for now. Okay, no obvious murmurs. I'll take a listen at the different valves though. Okay, and then right here, your arteries. Very good. No abnormal heart sounds, so let's do some breaths for lung sounds. If you could take a deep breath in. Deep breath out. Okay. Deep breath in. Deep breath out. Deep breath in. Deep breath out. Deep breath in. Deep breath out. Very good. Excellent, excellent. Just gonna do a quick skin assessment here of just the chest wall area. The skin looks like it's in good condition though, which is great. Okay. All right, and then just a couple measurements that I wanted to do here. Give me 1 second. Now we're just going to be doing a quick abdominal exam. Are you okay I move your gown over? Just wanted to make sure. First, I'm just going to listen to some vowel sounds here. So normal breaths, if you wouldn't mind. Just making sure I hear good vowel sounds in all quadrants. Next up, I'm just going to do some percussion here, belly. Noting the sounds. Okay, I'm going to press. Pressing. Any pain or tenderness? And I'm making sure I don't feel any enlargements. Excellent. I am going to pull this out over here for your legs. I just want to do a quick extremity exam. There you go. Just taking a quick look at both of your legs and your feet. Noting capillary refill. Very good. Let me just shine this light real quick to take a look at both sides. No issues in the extremities. Can I see this hand? Let me do a few more measurements here of the foot area. Okay. And next, I just want to make sure you feel vibration sensation in the extremities, okay? So, tell me when you don't feel that vibration. Excellent. Good. You're doing great. Good. A couple more times. Great. Excellent. Last up, we just have some reflexes here. Can you give me this arm? Okay. This arm, please. Okay. We'll go down to the patellar reflexes. Awesome. And then the Achilles. Reflexes are good to go. All right, I took a look at that urine sample that you left and everything looked good there. It looks like your physical examination is completed. You did absolutely fantastic, okay? I didn't see anything abnormal by any means. If you need me to give you a work letter just saying that you had your routine exam, definitely let me know. But otherwise, you did fantastic. I am going to give you some privacy to get dressed, and then the girls will see you at checkout just to make sure you have any documentation that you need and that you are all taken care of. Okay, that is not a problem at all. You did great. And if you need me for anything else, of course, you just come back into the ASMR clinic, okay? You're so very welcome. Have a good day.